Hey guys, I'm Dr. Allen from Pro Chiropractic, and today I'm going to talk about the McKenzie Method of mechanical diagnosis and therapy. So, big fancy phrase for something that I use quite a bit throughout the day. I've done the training through the 4 courses and done my certification. I finished that last summer. And the model of McKenzie Method is for 4 things, and that is assessment, classification, treatment, and prevention. So that's why we like it so much and why it works so well to combine with spinal manipulation and the adjustments that we do in the office here, because it works well for home exercises once we get through some of the treatment stuff. So the assessment is some historical questions that we ask of what's causing the pain, what makes the pain better or worse, a few things that correlate with that. And then we dive right into moving you around, seeing what's restricted as far as like range of motion, and how we combine that with what needs to be adjusted. And that goes right into some specific exercises that help improve that range of motion or whatever else is going on. So it's an assessment process and also a treatment process to determine the classification of pain into 4 buckets. So that's why it works so well to classify the pain, because sometimes patients get really confused of like, okay, what's actually going on? What do I need to do? What's causing my pain and how is this going to get better? That's where McKenzie is really helpful to give you a specific classification of one of 4 things. And once we give you that, then we have a really good plan in place of what we can do in the treatment room to help with some of the stiff joints, tight muscles, whatever's not moving well, or what's not stable, for example. And then we can give you something to do at home that will speed up that process. So at the end of the day, it gives you a really good idea of what's causing the pain from a classification standpoint, and then it just speeds up care, so you don't have to depend so much on us. And we can speed things up to make you feel better and then also prevent it from coming back. So that's why we like McKenzie so well and why it ties in so good with adjustments that we do in the office every day here. And some of the manual therapies we do, like dry needling, cupping, those are all just part of the picture. And we're always looking through a McKenzie lens, if you will. So that's why we like it so much. It works really, really well. I'll probably do a blog post about McKenzie too. And if you guys have any questions on it, I would love to answer any of those as well. So thank you very much for watching. And again, I'm Dr. Young with Pro Chiropractic.